Hi, this is Lindsay Sullivan, back live at Bone and Joint Institute for our monthly Facebook Live series with our physicians. So this is Dr. Colin Looney, and today we are discussing sports medicine. So sports medicine is one of Dr. Looney's specialties. So Dr. Looney, thank you for joining us today.
Thanks for having me.
We're excited to have you here. So before we really get kicked off and talk about sports medicine and what it is, tell me a little bit about yourself and your specialty as a whole.
All right. My name is Colin Looney. I'm a sports medicine doctor here at the Bone and Joint Institute of Tennessee. I've been here well, I think you've been here almost as long. We've been
pretty much. We came in together. Yeah.
About 15 years we started. So, Franklin and Nashville for about 15 years, and been practicing sports medicine for that time. Been on the sideline at Centennial for that long, and you started off at Ravenwood.
I did. Yeah. Many moons ago.
And then also been taking care of Battleground Academy as well for some time as well.
Perfect, and we'll talk about those two schools a little bit later. But so sports medicine is one of your specialties.
Yeah.
Kind of explain, what is sports medicine? Is it just athletes? Is it just kind of talk about it as a whole?
Right. So sports medicine is a broad field in which it's sort of a whole. It's taking the patient as a whole. And looking not just at the athletic injury, but as the patient who is an athlete, who has athletic desires. And an athlete is that's a broad definition. I mean, we're talking, very young kids that might be on their, peewee, baseball team, all the way up to the weekend warriors who work work through the week and then get out and do stuff on the weekend. And so it encompasses a large sort of vast swath of patients. But our objective in sports medicine is to get patients doing what they love to do. Absolutely. I mean, that's the sort of the objective, and that's a little bit different than orthopedics in the sense that, when you come in, not only are we going to ask you, what do you do for a living? You'll notice one of the things we ask you is, what do you love to do, right? Because that's sports medicine. I mean, when I talk to my 16-year-old, he's not going to tell me he loves geometry when he's in the room. He's going to tell me how much he loves, playing, cornerback for that. And that's not necessarily true, but often it is. So
so that goes into getting people back to what they love.
Right,
Why do you love sports medicine, and why do you love kind of the whole specialty as a whole within orthopedics?
Sure. Well, we talked a little bit about it yesterday. I mean, I had a great experience the other day where I bumped into a mom where I took care of their whole family. And what I love about sports medicine is kind of what she put all together for me and made me think about the other day was I love seeing, young athletes develop into great people. That boy, develop into a contributing fine young man, and then the girl who plays that I've taken care of forever on the volleyball team develop into a great woman leader. And so it's really the development of my patients and watching them through time, and that means a lot. And some of the people I've taken care of from all these high school teams, and they still call me. Some of them play sports on Sunday, and they'll call me and still pick my brain and ask me, okay, I'm up here, I'm playing here, what do you think about this? And so I love the relationship that we form with our athletes from a very, very, very early on. And this story I was telling you the other day was two twins that I took care of since they were little. But they really, when they got to Centennial, they were not the biggest starters on the team, but they were the fastest, they were the most explosive, and so they were always out there, and they were always getting hurt. And so I helped them through multiple ligament injuries, and then they went on to play college football, and one of them desired to play college football at West Point. And we even helped, say, look and talk. And West Point was reluctant to say, hey, we don't want someone who's been injured in one of our academies. And I said, this kid is not only 100%, he's 100% here and enthusiasm, and he's going to be a great contribution to the U.S. military. And so I remember, and I bumped into his mom yesterday, the day before, and just hearing what each is doing. Now he's out of West Point. He's a lieutenant down in Texas, as a sapper, and then going to probably go on to be a ranger.
Wow.
And then his brother is his brother's is an MBA school here in town, and will be a great contributor in the Nashville community. Both great. Well, I still call them boys. They're now men, and it's sort of the development, watching, being around and watching them, seeing the spectrum of, because one of the things that made those guys what they are is the fact that they had an injury, they played sports, and they stuck with it, and they overcame the obstacle of the injury to keep going and to keep playing, and that's made them better people. And I think that's what's fun about sports medicine is seeing that phenomenon, seeing that sort of spectrum of somebody's life is amazing. So.
And talking about, you are the team physician for Centennial High School
Right.
here, literally right down the road from us, but also Battleground Academy. Talk about your experience as a team physician. I know you kind of talked about the great relationships, but just talk about what you do for the school for all athletes and not just for football or basketball.
That's right. So we as sports medicine doctors are constantly communicating with what's called an athletic trainer, and so Williamson, the hospital has an athletic trainer at every high school in Williamson County. And particularly with the schools we're associated with, we constantly communicate with our trainers about various injuries and throughout the year, not just during football season. And we're talking baseball and lacrosse and so we take care of all athletic and a lot of non-athletic injuries that happen at school, frankly. So that's one element of it that's not just Friday Night Lights, but the beauty of it also is that our job is we get to be part of one of the best things in life, which is watching sports, right?
Yeah.
And so that's a great part of it, and it goes throughout the year, and so that's a real joy. But also our collaboration work with our athletic trainers, which you are.
I am.
is really a great part of the job, because figuring out that time to put that patient back in and return to play is really the art of sports medicine too. So
well, in talking injuries,
right.
So what are some of the most common injuries that you see or that you treat in sports medicine?
Well, and those are two different questions. One of my subspecialties in sports medicine is sort of unique. Mitch is taking care of very specific hip injuries in athletes. So everyone says, "Oh yeah, Looney, you're a hip guy, right?" And I'm like, "Yes, I am." But I also sports, I take care of a broad range of injuries. In hips, I do a special procedure where we fix the labrum of the hip and take care of soft tissue damage of the hip. And I see quite a bit of that. Fortunately, it is a little bit more unusual than the average sports injury. The typical sports injuries I take care of, and I have several this week, is the anterior cruciate ligament ACL injury, and that would be one of the most common that we see. Meniscus tears. Another procedure that we did this week that's very common this time of year because of contact is shoulder dislocations.
Okay.
And shoulder dislocations, the shoulder dislocates, you rip the labrum of the shoulder, and we often will arthroscopically or sometimes open repair that to stabilize the shoulder. So those are common. Rotator cuff is less common in that age group, so tend to be labrum, ACLs. Kneecap or patella dislocations. Those are another one we often will see, and so those are general injuries. And fortunately for our athletes, most of sports medicine is non-surgical, and that's great because a lot of sports medicine is that, hey, this is going to get better. This doesn't need surgery, but there is a timeline to return to play to make this safe. And so the sprains, the MCL sprains,
Those
are much more common than the surgical things, fortunately, and so we see a lot of that.
A lot of that.
Yeah.
Okay.
So.
And to close us off, Dr. Looney, we ask this every time we do this segment is talk about the comprehensive care that we offer here at Bone and Joint. So not only do you work with the athletic trainers, you work with the physical therapists and talking with the urgent care clinics and then all your partners as well. So kind of talk briefly about the comprehensiveness and how that helps the patient and in this case the student athlete.
Right. You know, we're a team here. Like this is, and sports medicine is a team. And so I mentioned the athletic trainers, and that's a huge component of it. But just down the hall is our physical therapy, and when we have an injury, we've got to work with our therapist and collaborate with them because they're doing a lot of the heavy lifting to get these athletes better. And so I'll often be in Dave Kenford's office and talking about this and talking about athletic injuries and just coordinating how our patients are doing. Yep. So that's one element of it. The other element is our after-hours clinic. We have after-hours at various areas in Williamson County, and so we're talking to our providers who are working there, who are seeing athletic injuries that are coming in the evening that happened that night on the field or in the court, and so we're coordinating with them, and then most importantly my partners. We all work together here, so this is a team effort, and I've got great partners, and it makes this job fantastic. So,
awesome.
Thanks.
Well, thank you again for your time today, and we will definitely you'll be out on the sidelines for Friday Night Lights starting in just 2 short days. So football
Can't
season
wait.
is here. Yes.
All right.
So Dr. Looney, again, thank you for everything. To get more information on our clinic or to schedule an appointment with Dr. Looney, give us a call at 615-791-2630 or visit our website to schedule online at boneandjointtn.org. Thank you.
Thanks, Lindsay. Thank you.